Hi, I'm Dr. Bill Black in the Department of Radiology at Dartmouth Medical Center, and I want to tell you a little bit about a study that was just published online in the New England Journal yesterday. The study is called the National Lung Screening Trial, and it was a randomized trial comparing screening for lung cancer with low-dose CT versus chest X-ray. Just to give you a little background, lung cancer is by far and away the leading cancer killer in the United States, and until this trial was recently reported, no screening method has ever been shown to be effective in lung cancer. As I said, the National Lung Screening Trial was a large multi-center trial of over 33 sites across the country. It involved over 50,000 subjects. These subjects were at high risk to develop lung cancer on the basis of their age, 55 to 74 years, and their smoking history, over 30-pack years. The screening intervention consisted of 3 annual screens with either a low-dose CT or a chest X-ray. The main findings of this study were a 20% reduction in lung cancer mortality in the CT arm compared to the chest X-ray arm, and a 7% reduction in all-cause mortality in the CT arm versus the chest X-ray arm. This latter finding of the 7% reduction in all-cause mortality is very helpful in indicating that there was not some large harmful effect from screening that was not properly measured in the mortality statistic, in the lung cancer mortality statistic. However, there were some downsides of the screening. Overall, there was about a 40% false positive rate in the CT arm versus only about 16% in the chest X-ray arm. However, most of the patients who had false positive results were followed with non-invasive procedures such as additional CT scans. Only a very few percentage of people with positive results ended up having an invasive procedure like a biopsy. Overall, there were slightly more lung cancers diagnosed in the CT arm versus the chest X-ray arm, about 10% more, which means there was probably a modest amount of overdiagnosis. There are still a lot of issues to be worked out, one of which is the cost of CT screening, and there will be lots of further analysis in the near future. Currently, there are no guidelines for who should be screened and how often, but those will be in development very soon. Thank you.